Everything that you've been told about symptoms and health is backwards. The fevers, rashes, swollen lymph nodes, sore throats, even tumors. These are not the body being broken or wrong. These are signs that the body is responding, adapting, trying to solve a problem. And once you see that, you'll never look at symptoms the same way again. I'm Steph, founder at Built to Heal, and in this video, I'm going to show you how the body heals itself in a way that's simple and visual, and why misunderstanding this is the reason so many people are chronically ill and why so many people fear their bodies. Quick note, this is information. This is not medical advice. Please use critical thinking, even with what I'm talking about today. The first thing is the wrong diagnosis, the wrong label, the wrong understanding of any disease process, of any symptom, of anything happening with your body will lead to the wrong action. It will lead to the wrong next steps almost always. And that's really the core problem, in my opinion, with conventional medicine and how they see symptoms, because they see symptoms as the disease. But the symptoms are just the signal of the disease process, and they mislabel them over and over again. So the obvious response, the next best step to take to support your body, becomes to shut that symptom down whenever you see it that way. And how do they do that? They will cut out the symptom or the alarm. They will kill it, or they will manage it lifelong with long-term interventions and drugs if they can't cut it out or kill it. And I want to illustrate that with just one disease label and walk through that with my what, why, and how analysis. And we can do this for any label or any symptom and see, okay, how are we thinking about these things and where does it lead us over time if we are to look at it in this way? So let's take arthritis as our first example. If you go into the doctor and say, oh my gosh, I have swollen joints, my joints hurt, and you get diagnosed with arthritis, you'll say, well, what is arthritis? What is going on, doc? The doctor will say, well, you have inflamed and painful joints. So they will point to the symptom and say, yes, your joint is inflamed. The next logical question will be, well, why are my joints inflamed, doc? And he or she will say, well, it's just because your genetics aren't that great. Your mom had it, your grandmother had it. It's genetic. Or if you're really unlucky, they'll tell you, well, it's also because you have a faulty immune system. You have a dysfunctional immune system. In the case of like RA, for example, they'll say, well, your immune system is just attacking your joints. Then you might ask, well, how do I solve this? How do I really address this? Can I cure it? And you'll be told, no, you can't cure it. What we can do is manage it lifelong for the rest of your life. How do we do that? We will give you NSAIDs, so non-steroidal anti-inflammatory drugs, okay? We'll take some of the pain off and we will try to reduce some of that inflammation. If it's so bad, we'll give you heavy-duty pain drugs, okay? Or we can give you immunosuppressant drugs. We'll give you drugs to suppress your immune response. But there's something major that they miss, in my opinion. Up here at the start, the inflammation, we can go one step above it. Why is the inflammatory response? Why is the inflammation there? So let's rework it in a way that we ask those questions. Well, maybe it's possible that the inflammation is there to help solve a problem, to help heal the joint. Because if you know anything about inflammation, it's actually a restorative process. It brings in more fluids, it brings in more heat, it brings in more helpful healing proteins to help reseal and restore the tissue. So perhaps the inflammation is there at the level of the joint because that joint needs to be repaired. But if you get this wrong, if you misunderstand what and why, your how is going to always be off. And the thing is, what's worse is not only are you not resolving it, you're pushing that material, that waste, deeper into your joint spaces and deeper into your tissue because it has nowhere to go. So you're setting yourself up for even bigger problems down the road. And the thing is people know that this is true. They know it's true in their own life. They know it's true when they look around at their friends and family. Look at the people who use drugs repeatedly. Look at the people who are constantly reaching for the antibiotics or the steroids or the Tylenol. Do those people get better? Do they get healthier? Do they have more vitality? Or do they keep coming back with more and more problems, usually worse problems? All symptoms are intelligent responses from the body. And let's just look at how the body responds when we get sick. This is the clearest indication what I'm saying is actually true. When we get sick, it takes this out of the realm of theory and turns it into observable reality. Okay, so when we get sick, our body tries to get rid of things in whatever way that it can. It has several ways built right into our system. If you eat something bad food, let's say, your body might throw up. If that doesn't work, it'll go to the other end, okay, with diarrhea to flush it out quickly. If you breathe in something harmful, bad air, like a bunch of dust or a bunch of pollution, let's say, your body will make mucus and force you to cough it up. Same thing, if you have bad drink, very obvious one is alcohol. If you drink way too much alcohol, again, your body will force you to throw up, to vomit. If you have bad stress, too much stress, you've known this in your own direct personal experience. If you have too much stress, you're too overwhelmed, that's the time you get sick and you go through diarrhea, cough, vomiting, fevers, all of the above, some of the above. Your body is always trying to purge whenever it's sick. So the body will use vomit, diarrhea, cough, and if it really needs to purge, it'll take you through probably all those plus a fever. And the fever works like a distiller or like an oven. It heats your whole body up, heats everything up to burn off the bad stuff, push out the bad waste, and allow your body to restore and repair. Now you can see here, these are all exits. The body getting rid of stuff when it is sick. These are all purges, the body unloading waste. Some of you might be sitting there thinking, well, this sounds a little too simple. But what I just described, although it sounds simple, is actually millions of processes happening in perfect concert to keep you alive. It is extraordinarily complex under the hood, and we'll never fully understand everything that the body's doing at a given time. But you know what is overly simple? What's actually oversimple? That your body attacked itself. That your body just went rogue because of bad genetics. Why? We don't know why it happened to you and not your sister or the next person or Sally or your mother. We don't know. You were born that way. And it's just that pesky inflammation that's causing all your problems. Now, that is the more complete understanding of how our body helps heal us every day, every minute, all the time, whenever we're exposed to different things, different foods, different environments. That's the picture of how the body heals itself. So as you can see, it all comes down to elimination. Now you just saw that the body acutely, when it has an acute poison or an acute exposure, it will purge quite uncomfortably and quite violently in some cases, like in the case of like projectile vomiting, you just gotta get it out. So you understand that, but that wouldn't be enough to have great lasting health. You'd have to really understand how the body's doing this every second of every day in several different organ systems and learn how to support that. And when you do, you have much less need to go through those uncomfortable symptoms, number one, and you have much more vibrant, lasting, wonderful health and less chronic disease. I put this analogy together and I think it works quite well and it's quite simple and straightforward. Think of your body like a big factory. Every day it's making things you need, but every factory also makes a lot of trash, a lot of waste that it has to know how to sort and get rid of so the factory can continue doing its job. Otherwise, there's a problem really quick. And your body has about 5 main exits for its own waste, for the waste that it produces and for the waste that it's taking in and it has to process. Your lungs, the exhaust pipe, are always running, always venting what the body's done with. You know that lungs are important for getting oxygen. We all have learned this, but you may not know how important the other half of your breath is. The exhale. Every breath out is your body releasing the spent exhaust from everything it burned for fuel. Carbon dioxide, waste gases, byproducts your cells are finished with. And when something gets in that shouldn't get in there, like we covered, debris, dust, any kind of pollution, your body forces a cough, forces a sneeze to blast it out of those exhaust pipes. It's like a muffler spitting out soot. You've seen this with cars. Your lungs never are off the job. Every single breath is a part of your inner cleanup, even though you don't know it. Next, the kidneys. Your kidneys are your body's filtration system, like a water filter, constantly running your blood through that filter to pull out the bad waste. Think of it like a pool filter. It runs through continuously. Water runs through the filter, catches everything that shouldn't be in the water so the water can remain clean, and clean water comes out on the other side. Your kidneys do exactly that, except what comes out on the other side is urine. And when that filter gets overwhelmed, okay, when our kidneys get overwhelmed, waste will actually hang out in our blood, in our interstitial fluids, and it backs up into our tissues, and it literally erodes our tissues. And guess what shows up? That inflammation that we keep hearing about. And that's there to help repair the tissues, because that damage is occurring and it should not be recurring. So that's when you start feeling the pain, inflammation, stiffness in joints, and you know you need to take care of your kidneys. Okay, next, the processing plant. Our liver is the upstream chemical refinery or processing plant. It gets the first crack, the first shot at anything harmful that's coming in that we ingested, and it uses it up or repackages it before the rest of the body has to deal with it. It takes in the greasy or the sticky stuff that our water filter, our kidneys can't necessarily handle, like old hormones that the body's done with, pesticides from our food, drugs that we're ingesting, plastics, any type of industrial chemicals coming in, things that don't dissolve well in water and that can't be flushed out through our filtration system. The liver will break all that down, repackage it, and it'll decide where it needs to ship it off again so it can be eliminated. That's how the body heals itself. It eliminates. Now the sticky stuff that doesn't dissolve in water, the body will use what's called bile to wrap it up and package it and ship it out through our sewage pipe. And speaking of the sewer, the colon, that is the exit chute at the end of the factory line. Everything that the liver wraps up, like I just said, that sticky waste, that old cholesterol, any kind of heavy metals or excess and leftover food, bulk food that the body doesn't use, and everything that your gut microbes produce in your colon and don't use, all of that gets pushed out of the exit chute. And it does that by using peristalsis, which are just muscle waves squeezing, like squeezing a toothpaste tube, and it just moves down the whole GI tract, moving out that bulk waste so it can exit the system. Now the problem is most people are walking around constipated. Their sewer pipe is backed up, not moving like it should be moving. And the problem with that is that those wastes that are marked to leave the body literally get sucked back in through the walls of the colon and dump back into your blood. And then your liver has to process the same load all over again. That's when you start seeing skin eruptions, extra long mucus in the stool, swollen lymph nodes. Your backup exits start picking up loads they were never meant to carry. So skipping days, skipping going to the bathroom is not just inconvenient and uncomfortable and bloats you. It's literally your whole factory backing up at the loading dock, so to speak. That pressure valve, every machine has a pressure relief valve that is a safety measure for when the pressure builds too high inside the factory and your skin is yours. It's always pushing out a little sweat to move some waste out. This is normal physiology. But when the other exits, like your colon or your kidneys, get overwhelmed, your skin really steps in. The skin will push out water, yeah, salts, yes, but also it'll push out waste that your kidneys particularly couldn't process fast enough. The oils in your skin also push out fat soluble, the greasy waste that your colon couldn't get rid of. This is why, again, eczema, acne, boils, rashes, these things flare when these exits are backed up. So you can see here, using something like a steroid cream, say you have a rash and you put it on your skin, it's like welding the pressure release valve shut. Like there's a reason that that's happening. Again, it's not comfortable. It's not enjoyable to experience these things. Obviously, we don't want them to stick around, but just looking at the symptom and trying to suppress that symptom is not intelligent. Now, when these main exits are struggling, your body gets real creative. Your body has brilliant other ways, like plan B and plan C's, to keep things moving. For example, your nose. Okay, runny nose, eyes, ears. These are local drains in your head, particularly when things become too backed up. So you also have local drains. Next time you have a clogged ear, a runny nose, sinus issues, you should be asking the question, what is my body trying to eliminate right now? Now, in our factory situation, we need a way to transport things, and that is the drainage highway, otherwise known as your lymphatics. None of this would work without a system tying it all together, and it's absolutely critical that you understand your lymphatics. The highway that connects our elimination ports. Think of it as the garbage trucking network, a drainage highway that runs to every corner of the factory, collecting waste from every single cell and hauling it to the main exits that we just talked about. As you know now, every cell in your body produces waste, and that waste gets dumped into your lymph fluid. That is a clear fluid that bathes and lives outside of every cell and outside of every tissue. And most people don't know this, but you actually have more lymph fluid than you have blood. So these lymph nodes that you can feel all along here, you want to think of these little guys as little trash bins, little septic tanks. Okay, your house has septic tank to hold its waste. Or more simply put, you can just think of it as little small trash bins. They hold waste and they house tiny little microbes that break down those wastes, like little worms breaking down and composting waste in your garden so your garden can use that for fuel and for energy. Those microbes are not invaders. They are a part of the cleanup crew. So when your lymph nodes swell, when you have swollen nodes, people think, well, my lymph node is infected. I might need to go get my lymph cut out, or I might need some antibiotics to kill off the infection in my swollen lymph nodes because it's painful and inflamed. But a swollen lymph node just means it's a working lymph node. Your lymph is full of trash. That trash is trying to be taken out appropriately. You should support that process, doing all the things that we're talking about today, supporting these final exit routes so that can be unpackaged in a much more speedy way. But a swollen lymph node is not an infected lymph node. It is a working, full lymph node. And if you go in and you try to kill this cleanup crew and you try to suppress the swelling of the node, you are essentially like just pouring bleach into the system. Your septic tanks in your house and your body will fail. The breakdown of that waste will stop and it'll have nowhere to go, and the highway will be compromised. Thus, it will not reach its appropriate exit. And a topic a lot of people like to talk about, tumors. If that backup goes long enough and your body starts storing it because it has to store it because it didn't get properly broken down, you just killed the microbes for it, or you cut it out, or you suppress the inflammatory process, which is part of the healing process. If you did those things, then you will force the body's hand to then have to start storing in cysts and tumors around the body that garbage, that waste, because it had nowhere to go. So a tumor is stored waste and dead, damaged cells. Nothing to do in this perspective that we're talking about of random mutations, bad genetics, immune system turning on you. We're not talking that. We're looking at it, oh, the body responded intelligently and it stored this waste until it can deal with it. Tumors increase and they shrink. Why do you think that is? You may have had your tonsils out, which by the way is lymph tissue, or you may know someone who had their appendix removed, lymph tissue. We're told that this is fine, you don't need them, just cut them out, they're inflamed. But your tonsils and appendix are part of this system, this highway system that I'm talking about, to process waste and to ship it out in the right exit. Removing them because they're swollen is like blowing up your septic tank in your house or your factory because it's full. I don't like that that's full, let me just go blow it up. Well, turns out blowing things up or killing them or pouring bleach down them doesn't work because you actually need the septic tank. You actually need that in your factory and in your body. So doing that, again, not terribly intelligent. That waste, just like I pointed out with a tumor, will back up. Either it'll be stored or it'll back up into your organs, and that's when you have kidney damage. It'll back up into your liver. That's when you have liver cirrhosis. It'll back up into your glands. That's when you have issues in your thyroid. This is where you start to see all the symptoms and pathology start to make sense. Whenever you look at, oh, this is what I've been doing to my body all along. And I didn't even know that I wasn't supporting my elimination routes. And I didn't know that I was suppressing the body's need to get some of that waste out. And here's the big picture of this entire presentation. This is what it all boils down to. When waste cannot leave a cell, that cell dies. When enough cells die and can't thrive, you die or you get really ill. And what's more is when enough cells die in one place, your body does the only thing that it can. It walls them off and stores them as a tumor. That's a tumor, that's a cyst, that's a fibroma, that's a boil. And if someone has a bunch of tumors all over their body, that is a clear indication that the body has had to go through that process repeatedly in many different locations of the body. So that is a very advanced situation and stage and phase of a body that has been ignored, suppressed, forgotten, and misunderstood. So that means it would be time to listen up if that is happening for you. You were not born with spare parts. You were not born in a body that is designed to keep you alive, and it's just constantly messing up and creating bad situations for you all the time that you're having to manage, cut out, burn off. That's not what's happening. Your body was created intelligently and it responds intelligently. You were not born with spare parts. Every structure in your body has a purpose. So when we remove things, cut them out, we're not solving any problem. Now, I will add a caveat here. If you have a tumor or something that is impairing, like I had a client once who had a tumor in his stomach, and that can start to grow and store. That's not a wrong response, but that can start to grow and store in an area of the body that starts to impede further function, like digesting your food. So in that case, sometimes it makes sense to remove that. In certain cases, it's a case-by-case situation. But you would have to address why the stomach had to produce that bag of waste and that tumor in the first place. So it would take understanding that from the beginning to be able to really support the body through that surgical removal anyway. But just willy-nilly, without much thought, cutting things out is not going to solve the problem long-term. Now we're going to need some electricity to run this system. The power grid, what is giving our body power? And that is electricity. Did you know that your body makes its own electricity? You're technically your own battery. And if that ability to generate and conduct electricity in your body corrodes or it slows, everything in your system stops. And our body generates its own electricity from various sources. Dr. Jared Pollack showed this in the lab when he looked at how water behaves inside our cells, inside our vessels, and that it generates its own battery and its own electrical charge. And what he found is that you have negative charge outside of your cell, let's say, and you have positive charge in the middle. And the healthier the cell is, the greater that difference in charge is in the cell. You'll have a greater zone here of negative charge, and you'll have an appropriate zone of positive charge. And that balance between those two charges literally drives energy, and it allows your body to do work, to actually run its biological processes. Now, what happens is whenever you have waste build up into the cell, like we keep talking about this whole presentation, that loses its charge. This area here of negative charge shrinks. And then the whole system starts to slow. The electrical conduction starts to slow throughout your whole body when that's happening on a systemic level. Less charge means less flow. You have less flow, then you have more waste buildup, and that'll create even worse flow. So it's like this vicious cycle of chronic disease. And the body gets fueled by the most basic inputs. You know this, quality food. We need light, natural light, sunlight. We need good water. We need heat and movement. Movement generates heat. This is what keeps our electrical system, our electrical grid strong. When the power supply is strong, we have nutrients that go into the system, get into the cell in a proper way. Then you have waste that can get out effectively. And you feel good. You know how this feels when your body's working like this. Everything is running how it's supposed to run in this case. Now, when the power supply is weak, your waste will build up because flow slows and you feel bad. You feel real bad. And that cycle of damage just keeps happening over and over and over again. This is why people spend years and years with chronic disease and chasing inflammation and trying to stop inflammation, but they haven't addressed what's actually happening on the biological level and really understanding how the body heals itself and how it works. But you already know that this is true about your own energy, about your own electricity, about your own battery. You feel it. How is your energy when you're sick? When your body's going through those difficult purges, whenever it's reached its max? How do you feel when you're sick? How do you feel after you eat terrible food? How do you feel whenever you haven't slept? How do you feel whenever you haven't moved in weeks, months, years, you haven't exercised, or you haven't even been outside in days? How do you feel? That's literally your power supply failing in real time. And when it does, every exit that we just talked about slows down and every process in your body slows down. When you could just step back and take a look, what am I doing to not get the inputs I need to support my power supply so my body can continue to run the processes so it can clean house? Your body has its own language, and the question is, are you listening? Because you might be thinking to yourself, well, how do I know which system I need to support and which system is struggling? Well, your body tells you in its symptoms and how it expresses itself. So we can go through these. We can talk about some of these symptoms and what system they are really associated with many times. Now, let's be clear, this is not a one-to-one. So for example, you're going to see right here, puffy, swelling, your pee's nasty, your pee stinks, it's dark, it has foam in it. This is a telltale sign that your kidneys are struggling. However, you can have issues with swelling whenever your lymph is struggling as well, right? It's not a one-to-one. These things overlap because your body in its brilliant ways has so many ways to adapt and compensate for other systems that are struggling. So we don't ever really know exactly what's the start of something that's going a little bit off and that we need to help and assist, but we can say, okay, clearly I'm having some of these symptoms. Clearly I need to support my kidneys. Next, we have nausea, particularly post-meal nausea. So say you eat a meal or say you eat a particularly larger meal than you would normally eat and you get quite a bit of nausea. You're looking at your liver struggling to help process what's coming in. Or if you have light stool or if you have a sticky stool, also can point to the liver. Headaches are associated with people who really have issues in their liver. Your colon, if you have hard pellet type stool, if you have sticky stool, again, it overlaps with the liver because these are part of the same GI tract. And if you skip going to the bathroom, if you're only going to the bathroom once every 3 days, if you're only going to the bathroom truthfully once a day, usually not enough for people. If you have phlegm, if you're frequently clearing your throat, especially if you wake up coughing and clearing your throat and have phlegm, that's a really good indication here. Or if you have chest symptoms frequently, so say whenever you go through an acute purge like we were talking about and you have a fever, you also have a lot of chest symptoms and you have that once a year, twice a year. This is a sign your lungs are taking the hit. They're really trying to pick up the slack to process some things for you. And down here, if you get rashes, you have eczema, and especially when they're worse after stressful events, so I always ask people, well, did you recently travel? Is that why? Oh yeah, I did travel. Well, travel's stressful for all of us. So after stressful events or travel particularly, because it's a telltale sign, or if you get moles, spots, and skin damage, if you have these little white spots or cherry angiomas and you just have these random spots on your skin and moles growing and new growths, you can be sure that your skin is picking up the slack for you. And what happens whenever that waste material comes through the skin, it will literally damage the skin on the way out. And that's just a byproduct of the body still needing to get it out. People often will ask like, well, if my body's damaging some of my tissue, just to eliminate, shouldn't it not do that? That's not very intelligent. Oh yeah, that's not intelligent? Well, you would die much sooner if your body didn't eliminate it. So it has to. It's thinking, I'll compromise some skin cells. That's way better than compromising my entire inner workings and processes. I got to keep these things moving, right? So it very intelligently chooses what will keep us alive longer. And that's just to put it in a very simplistic way. Obviously, the body doesn't think like that, but it's very much designed, as far as my experience and just observing how the body works in my own life and working with people, is the body is designed to know that it has to keep things clear, clean, and purified. And it knows that it has to make sure that it gets its waste out, because that is the quickest way to break down the system, is if it loses its ability to eliminate waste and to eliminate metabolic waste, toxicants from the outside, toxicants that your body is producing itself, toxic byproducts. It knows that that is a huge problem and a huge alarm signal if it cannot do that. So once you know what to look for, once you're paying attention, once you wake up and say, okay, I'm listening, your body is handing you a map. Now, as we wrap this all up here is what I'd love for you to take away from this. Every symptom you've been told to fear, suppress, cut out, chemo, radiate, that was your body doing the most intelligent thing it could with the resources that it had. And the real question was never, what disease label do I have? What pathology do I have? Again, a very unintelligent question, if we're being honest here. The question is, what am I not eliminating? What is my body struggling to get out that it needs to get out? What have I done over the years to impede that process? And am I doing the basic things I need to do to support those processes? And that's what my entire Built to Heal philosophy is established on. And that's what I'm going to keep teaching you here and everywhere I show up. If this has shifted anything for you in your understanding and your perspective, please feel free to send it to someone who needs to hear it, because more people need to understand the language of their body.